until several months into 2021.
Joining us now is Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor. Thank you for joining us this morning.
Good morning.
I saw a tidbit here about schools, which I know people will be anxious to hear, that maybe there's not much of a link between schools and COVID.
Well, the link, now that they've looked at it really scientifically, the link is more that the schools reflect the community. The schools are not driving the epidemic or pandemic. That's actually a very big distinction because, you know, if that's really the case, then schools really should be reopening soon.
Well, that's a big no. So what has to happen? Are you saying that if people in the community are wearing masks, then schools should be open, but not the opposite?
Well, no, if the community is controlled, the school will be controlled. So if the community is being careful, they're wearing masks, social distancing or whatever, the school will be controlled. In other words, there won't be like a little burst in a school that will then send the epidemic back to the community. You know, the schools won't be a super spreader place. They're just reflecting what's going on in the community. So if there's a lot of cases in the community and a lot of cases in the school will have to shut down for a period of weeks. Well, but they're not the super spreader event. We thought that originally that, you know, maybe the schools with all the kids together and everything are going to be spreading it, and that's going to be where the epidemic is coming from, and that's not the case.
That leads us to the story that we mentioned briefly last week about the moms in Utah. Talk about what they're doing.
Cheating. They're cheating. You know, they're saying don't test your kids. So when a case pops up, you know, a hallmark of good public health work is contact tracing. If your friend's kid gets infected, you need to test your kid. And then all those people just have to be quarantined, you know, for a period of time. It's not forever, it's just for a period of time. So what these mothers have done is they said, we're not going to test anybody. It's basically like putting your head in the sand.
Let's talk about this study about mouthwash, which is interesting, it having an effect on COVID. Talk about the details of that.
The details, so this is a laboratory test, so be careful before anybody goes guzzling mouthwash. You know, we've always said from the beginning that this is a very fragile virus. Just soapy water, any kind of disinfectant actually will kill it. And the same is true for mouthwash. Now, in the laboratory, 30-second mouthwash rinse reduce the amount of COVID in the mouth substantially. So it's just another protective measure. How often it should be done, you know, we don't know yet. Now there's going to be clinical trials where we actually give it to small groups in the population.
All right, let's get to some viewer questions. This person says Indiana and Wisconsin are on a 14-day quarantine list. If I have a summer house in those states, can I go to it? I do not need to stop at any stores or gas station.
Well, you know, we're talking about a law. You know, would it be safe for you to go and not interact with anybody and then come back? I mean, I would think that would be okay. But I was looking at the law earlier this morning to kind of check this question out a little bit more. If you go to Wisconsin or Indiana for a day or less, the quarantine thing does not take effect. But if you're there for the weekend, the way I'm reading it, it would include you to have to quarantine. But I mean, I would check with your public health authorities.
All right, next question. For immune-compromised patients, will the COVID-19 vaccine contain a live virus?
No. These are synthetic vaccines, synthetically manufactured vaccines, so it's not a live virus.
All right, next question. Is there a way to find out the number of people who test positive but are asymptomatic?
Yeah, this is a really, really important question. The only way to do that is to compare the number of cases we have with the same population, but look at their antibody tests. And that actually is the study I had mentioned earlier about the SCAN study. We're testing antibodies in a variety of different populations. So you select the populations you want to study, you test everybody for the antibody, and then you can figure out the proportion of people who've been infected compared to the proportion of people who've been reported to have had disease. So the studies that have gone on before showed that maybe as many as 40% of people are not being counted.
All right, well, if you have a question for Dr. Murphy, you can go to our Morning News Facebook page and post it there. We'll talk to him again tomorrow. Thanks, Doctor.
Okay, have a good day.
You too.
Hey, Morgan.